Clinically Speaking is our advisor series of short videos featuring clinical updates from Vitality clinicians and experts in their fields.
March is Prostate Cancer Awareness Month, and today I hope to cover the basics of prostate cancer and how increasing your awareness of this can benefit your clients. Early prostate cancer doesn't usually cause any symptoms, and that's because the cancer cells begin in the outside of the prostate gland. So if they're going to cause symptoms, it means the prostate gland needs to become so enlarged it presses on the urethra. So if we talk about advanced prostate cancer, that can be divided into locally advanced or spread when it's become metastasized. So if it's locally advanced, that's when you'll get urinary symptoms. And these symptoms are passing urine more often, getting up in the night to pass urine, sometimes pain, and sometimes you can get blood in the urine or semen. If the cancer has become so advanced it's now spread, then sometimes the patient can present with bone pain, or sometimes actually they present with a fracture, and that's known as a pathological fracture, and the diagnosis of prostate cancer is made. BPH is benign prostatic hyperplasia, and simply this is an enlargement of the prostate gland. This is really common in the older man and can cause urinary symptoms. It's important that men don't dismiss these urinary symptoms as a simple part of getting older and seek medical advice. So for prostate cancer, there's no clinically proven preventative factor for this disease. We do know that some men are at higher risk of getting it though. So ethnicity. We know that black men are more likely to be diagnosed with prostate cancer, and those with a first degree relative, so a father or brother, and those that have a strong risk of breast cancer in their family. Overweight and obesity is the second biggest preventable cause of cancer after smoking. Data from observational studies suggests that physical activity can reduce your risk of developing cancer, and this is thought to be down to hormones. Physical activity reduces the level of hormones and therefore reduces the risk of developing cancer. But actually we know that these individuals often engage in healthy lifestyles. At Vitality, we give your clients the tools and the incentive to improve their well-being. Our member data suggests that engagement with our Vitality programme can reduce the risk of getting cancer. So currently there is no screening programme for prostate cancer, and that's because we don't have a reliable enough test to use in a screening programme. So how is the diagnosis of prostate cancer made? Well, that's done based on a blood test, the PSA, prostate-specific antigen, an examination of the prostate, and an MRI scan. Sometimes a biopsy can be done at the time of this MRI scan. So the current advice in terms of a PSA is if somebody wants to find out if they have prostate cancer, to discuss having a PSA level done with their GP. And this is sometimes because the PSA can be raised in BPH, or sometimes it's not raised when you have cancer. So the first step is to have a consultation with the GP, discuss any symptoms, and discuss whether it's appropriate to have your PSA examination and MRI scan. So active treatment for prostate cancer, well, that depends on several factors. So first, the size of the tumour, whether it is spread, and the individual health of that patient. So treatment can be divided into 3 areas: 1, surgical, 2, hormonal, and 3, radiotherapy. The surgical options, well, there's 2. One is removal of that whole prostate gland, so that's a radical prostatectomy, and the intent here is to cure the prostate. The second option is a transurethral resection of the prostate, and that's where part of the prostate gland and part of the tumour is removed, and that's really to relieve symptoms, so those urinary symptoms I discussed earlier. Hormonal treatment is another option. Prostate cancer is driven by the hormone testosterone, so if we give treatment to reduce the body producing testosterone, we can slow or shrink the tumour. This can be given either as a tablet or an injection. If injection, then patients are taught how to self-administer them themselves. Radiotherapy. Radiotherapy treatment is high energy waves similar to X-rays which aim to kill the cancer cells. And for prostate cancer, this can be given either internally or externally. Well, the role of insurance in terms of healthcare is about timely access. If your client can access the right information and right medical advice and review straight away, that leads to an earlier diagnosis and better outcomes. Your client will have access to the online portal. They can book a virtual appointment with the GP, discuss the PSA. They can be seen by the GP and, if needed, referred to the specialist early, and that leads to better outcomes. Our Vitality plans include advanced cancer cover, and this means that all eligible cancer costs, inpatient and outpatient, are covered. But not only that, we provide a cancer care consultant to support the patient or support your client through that journey, and they have a named consultant who they can contact. Vitality Health not only covers the finances, but it provides that specialist support and care every step of the way.